Welcome to another edition of Labor Live. If you were joining us early this morning, around 5 a.m., you would have seen Eliza give birth to her baby calf. With me today is Dr. Harden and Dr. Randall from the University of Nebraska School of Veterinary Medicine and Biomedical Sciences. Dr. Harden, can you give us a little bit of commentary of what you were seeing when you went in early this morning?
Absolutely. What you're observing here is what we call second stage labor. So the cow is under given abdominal contractions, and you see the feet have been pushed out, and we're waiting for the head to clear the vulva, and so she's straining. The head's quite an obstacle for him to push out, so it does take some time. As we move forward here in the clip, you'll see the tongue appear, as the head. Prior to this stage, we did go in and check to make sure that the head was in the proper position. So we knew that the calf was in the proper position for a normal birth.
And Dr. Randall, how important is it to have that proper position when a calf is being born?
Well, certainly the idea is we know that the calf normally comes out head first, two front feet extended with the muzzle laying between the legs. If there's any malposition, such as a head turned back or a leg back, they just physically can't have that calf unless you correct that and get it in the normal position. So we want to check early to make sure everything is good so she doesn't prolong labor and give distress to the calf.
And just looking still at the replay, it's getting closer to the head actually coming out. Dr. Harden, when do you go in and make sure that everything is okay?
What we really look for here is to make sure that there's progress. And so if you watch every little contraction, you see a little bit more of the calf appear, a little more of the leg. Now you begin to see the tip of the nose. With the membranes over the top of the nose, it's a little difficult to make out, but just if you keep watching over the next just few seconds, with each contraction you'll see a little bit more. There the head's the end of the tip of the nose is protruding. As long as they're making progress, we don't really intervene at this stage, so we just watch to make sure that that progress is being made. If for some reason they were to stop, and sometimes they do, their muscles fatigue, then we would provide some assistance and help them by pulling on the calf. But we usually just let nature take its course here and just observe and watch. As you here in just a second or two, you'll see as the head gets further out, I'll walk up and I'll remove the membranes from over the tip of the nose. At this point, the calf is still receiving its oxygen supply through the umbilical cord. So it's not until the head is outside the vulva that then at that point the umbilical cord is near the pelvis, and you're at the point where you'll begin to preclude blood supply to the fetus. And at that time, then the calf's going to start needing to breathe. And so anything that's over the nose obstructing the air passages, needs to be dealt with. Most of the times the calves in the normal circumstance will shake their head. So now I'm moving up, and I took the membranes off of the tip of the nose, and you'll see it progress pretty rapidly from now. She's got the head out, so now that's the big hurdle for him, and then she'll push pretty quickly. And here is that she delivers the calf. So now you can see the calf begin to move some. And so now he's got to start breathing, because the umbilical cord that was supplying him oxygen through the bloodstream of the cow is being cut off. Okay, so now the calf is out. They usually do rest a little bit once the thoracic cavity is through. Now she's pushed him on out now. So and so we're going to walk up here in just a second and start rubbing on the calf and making sure the nose is clear, and kind of massage, stimulate him so he can breathe. So that's what we're doing here. Sometimes you'll take straw or something and tickle the nose, because that'll stimulate him to take the first breaths. and now we're rubbing him down again. The purpose of all this is really to stimulate breathing.
So is the straw technique that you were talking about, is that something on the lines of, almost acting like a sneeze?
Yes, that'd be a very good analogy. It'd be acting like a sneeze. It's just, a little bit of tickle, so they kind of cough, and if you'd hear the sound segments that were going on at this time, he was coughing a little bit because they do have fluid. When they're in utero, they're surrounded in this big bag of fluid, and so they're actually fluid's moving in and out of their lungs, and so that has to kind of be moved out so they can breathe. Yeah.
So after it is born, what are some things that you're kind of looking for, at the moment?
So the most important thing is to make sure they're breathing. So you notice I put him up kind of sternal, so that helps expand his chest cavity, so he can breathe. And then for the most part, then we put some straw up there, so we get him up kind of a little bit out of the fluid, and then we're going to just kind of leave him alone. So, and of course the cow's resting, and then the next thing it would be for the cow to get up, and then she'll start licking off the calf. And she needs a rest for a few minutes, but you do want the cow to get up and really start taking care of bonding with the calf. The cow's tongues have reasonably rough to the touch, and so they really massage them. You'll see as you watch that portion of the video how she really kind of works him over. Then the next thing is for the calf to get on its feet, and nurse. Now what's going on here is we're making sure if there's any mucus plugs in his throat, pieces of membrane or stuff, you want that out, so again it doesn't obstruct his air passage. And so then, like I said, following, we'll just let her rest now, and the calf kind of continue to establish his breathing, and then we'll want her to get up on her feet and start licking the calf off, and then the burden's back on the calf at that point to get on his feet so he can nurse the cow. Cows, the type of placenta cows have, they're not born with any immunity. Humans, we receive immunity through our blood supply, and it crosses the placenta, and so human babies are born and have immunity against diseases. Not the case in cattle. They receive all their immunity by the first milk that they drink, and it's just critical that they drink that first milk as soon after birth as possible.